Single leg training is one of the greatest ways to train your core to work how it's designed to work during movements like walking, jogging, running, any functional movement where you're on one leg. One of my favorites is the deadlift or hip hinge variations that you see so many people doing in the gym. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and founder of the Vagina Doc. And in this video, I am going to go over the single leg hip hinge or RDL. The purpose of the single leg hip hinge is to train the glutes and hamstrings as well as the other helpers on one leg, either to strengthen, to stabilize, and then while the core muscles of the trunk work to keep your spine and pelvis in neutral and square and connected with your rib cage. The other way your core or outer core is working is that the opposite glute of the one that is grounded to the floor, so this one will be hanging or in another variation that I'll go over in other videos, is your glutes are keeping your hip in extension so that you're matching or you're in neutrality with or in line with the rest of your trunk. It'll make sense once you see it. Like I said, we're working the glutes and the hamstrings and the core and the core muscles to execute the purpose. So your setup is such that your spine is in neutral, ribs are stacked over your pelvis, and you're connected with your core just enough as you need to keep your spine in neutral position. Shoulders are going to be square to your hips the whole time, and you're going to tip from your hip, and your chest comes forward until you're about like horizontal, and then you come straight back up. So from the side, I'm tipping from my hip, chest comes forward, my spine stays in neutral, and then I come up and stick the landing, so it's in control. Take a look at my leg that's lifted. It is in line with my trunk the whole time. As you tip from your hip, your knee looks like it's bending. Some of your knees will look like it's bending, others that you could keep it straight. But it's not coming from the knee. It's coming from my hip. So my shin stays vertical the whole time. As you tip, pay attention to what you're feeling. You want to feel most will feel a stretch behind the back of their thigh. And then you want to match that stretch by squeezing your glutes to return to an upright standing position. From a breath standpoint, when you are ready to focus on this, you breathe in as you go forward, out as you go up. Other things that as you are used to this movement, you want to pay attention to little things like your foot. With your foot, you want to stay really active and connected with the ground. Heel down. You're splaying your toes down into the floor without crunching them. So it wouldn't look like your toe knuckles are bent like this, they're straight. Common errors that I see with this movement. Now, this is a variation, but this is not what I want whenever I coach it the way I just showed, is loss of this position. The hip is broken forward. And that's okay, it just changes the tensions across the pelvis. So for this specific variation, I want, no matter what your knee's doing, I want your hip, this part of your body to be in line with your body. The other thing I see is like opening up or closure when you're going forward. It's like people like rotate. And again, that's okay if that's intentional. I do program that as a specific exercise, but if your goal is to keep your shoulders and your hips square, you want to keep them square. Couple tips to maintain neutrality here, your shoulders and your pelvis square, is this hip. Squeeze your glutes to keep that hip in extension. It's not just going to hang there. You got to connect with it. You can also engage your quads as well and point your foot if that works for you, but make sure that it's not just that your hip is staying in extension. It's not just your knee. And that would look like this. You drop here if you're just focusing on your knee. In the upcoming videos, I'm going to show you the other variations that might be a little bit easier or train this movement a little bit differently. How I train this is I can put weight on both sides or on the side that's elevated. And I would do that if I'm working on strengthening. I could do this on an unstable surface to work on more stability. And then I can do this in a dynamic way where people are pushing me or throwing stuff at me and I have to stay either in the position or from falling over. We can do this in pauses. We can do this in smooth tempos depending on the goal. Or we can do this really quick to work on speed and reactive control of the posterior chain and the core. So if you have any questions, post them below. Thank you so much for watching. If you're not already subscribed, be sure to hit the subscribe button so that you're notified every time a video is launched. Again, my name is Dr. Jocelyn Conley. Thank you so much for watching. I'll see you on the next video.